Okay, I think we'll start just now because I think that there may be other people joining us, but the time's come round. So greetings everyone, good day and welcome to today's webinar. For those of you that don't know me, my name is Dr. Gary Smith and I'm the President of the Faculty of Homeopathy here in the UK. And it's great to see everyone who are joining both from the UK and from various different countries around the world. Thank you very much for being here. This event is being recorded, just so that you're aware of that. And the recording will be then made available afterwards to view on the usual channels afterwards. So if you're watching that or if you're joining us today, thank you for tuning in. This is the second webinar of a series of 5 webinars this year, and I think it's the 9th overall in this series that represents a collaboration between the Faculty of Homeopathy and VithoulkasCompass. And I'd like to say again how pleased I am to be collaborating in this way and providing these sessions, pardon me, such as this. And thank you to our friends at VithoulkasCompass for their support of the Faculty of Homeopathy. Looking down the list, I can see people that I suspect that I think actually this may be your first out of these 9 webinars. So if that's the case, you're doubly welcome. Thank you very much for joining us. These are always interesting events with interesting cases and some interesting discussions. So please come back again. And if you've been at every one so far, then I don't know, maybe you might deserve a prize or something. We might need to discuss that, but I think there have been some people who haven't missed one. So thank you for being here. As you know, our speaker is our good friend, Andrew Ward, who's very well known to us. Andrew is the UK ambassador for VithoulkasCompass and is extremely busy in homeopathic practice and in homeopathic education for over 30 years. It's great to have Andrew with us again. As you know, his subject today, he will be presenting a case of osteomyelitis successfully treated with classical homeopathy. And once again, Andrew will be demonstrating how that correctly chosen homeopathic medicine can bring about profound healing effects in what is a very, very difficult and very, very challenging condition to treat, osteomyelitis. And in particular, he'll be showing how using the VithoulkasCompass software can be helpful in choosing both that initial prescription and indeed the follow-up thereafter. So I'm looking forward to this event. I hope that you find it interesting and informative. Please add your questions to the chat box as we go through, and we'll put those questions then to Andrew at the end of the presentation. And I think without further ado, I will hand over to Andrew. Thank you.
Thank you very much, Gary, as ever, and very grateful that you're able to introduce this webinar on a Sunday. It's you know, it takes a lot of your precious time, and also thanks to VithoulkasCompass and the faculty for their collaboration support in this great project we have going. Okay, this case actually dates back 10 years. So it's back in, let me just share my screen here. Okay, because I have this time the whole case, so we can read this as we go along. The case written down. So this is a case from my files in the past. September 2013, a 60-year-old lady came to see me with a diagnosis of osteomyelitis in the right lower jaw. Now, for those of you not familiar or don't know, osteomyelitis is termed an inflammation of the bone marrow due to infection. In this case, it was after a dental procedure that brought about the infection, and then this inflammatory condition usually occurs after some kind of injury where the bone's been exposed. So it can be an open fracture, a wound, or an operation, as in dental operation. Usually Staphylococcus is the culprit organism. And you've got obviously acute presentations of it with inflammation and pain and some fever. And then you have the chronic form, also inflammation, pain, and suppuration, so with infection. And often over a period of time will lead to bone loss, necrosis, and dead bony tissue, which needs surgically removing. And I think sometimes they may do bone grafts and all sorts of things that are difficult. Relapsing form, so you have this underlying inflammatory condition with acute flare-ups. So this is, in this case, the condition's there all the time, obviously, but it has these bouts of flare where the pain and inflammation gets more acute. The treatment usually is long-term antibiotics, can be for years, to try to suppress the infection. Now, in this case, her condition was diagnosed in 2009, and she'd been taking antibiotics for 3 years at this point, which had had some consequences also in her digestive system. Due to length of time already, there was some bone loss and destruction of jaw tissue reported in the x-rays. This had the added complication of producing, as I said, frequent nausea and stomach upsets. Now, she presented as a very well-prepared, organized woman, hating to be late, likes to know everything going on in her family. She said, "I'm a bit controlling, to be honest." And so her symptoms she presented with was a constant throbbing pain in the jaw with swelling. And then she would get these acute exacerbations at intervals with some fever. The pain could also spasm from the jaw to the head and neck. Some bone loss, infection of tissue. Also night sweats and general low energy. Occasional episodes of angina with chest pains and dyspnea, difficulty breathing. Also she suffered with. Now in 2009, she had some tooth extractions with antibiotics, and this started the whole problem off after this. History of bronchitis as a child, leading to some asthma. No longer. Cough every winter, especially in the cold air. Slightly raised blood pressure since her last pregnancy. Family history. The father had a heart attack in his mid-40s, and her brother, heart attack, 60 years old. This already puts us in mind of a particular idea, miasmatically, which we can talk about later. This year, she had developed a new set of symptoms, which was pain in the right hypochondria region, especially when eating to satiety, so eating to fullness. So questioning here, possible gallbladder issue. All her problems seem to be on the right-hand side. She also has a pancreatic cyst. A CT scan revealed a benign neoplasm of the pancreas, which they were keeping an eye on, and a cyst on the right lobe of the liver, benign. Also, in 2009, her mother died, and then her pet dog. So there was a lot of grief in that year, as well as the dentistry that started this problem off. Suffers acid indigestion, and the lymph nodes on the right side of her neck swell up. Aversion to extremes of temperature. Cannot lie on her right side because of the jaw pain. Prefers to sleep on abdomen. Right shoulder pain also. Loose stools in the morning after rising. Thirst at night. Strong desire for hot drinks, yogurt, cheese, and sweets. Sweets very strong. Unrefreshed sleep in the morning. And low energy in the afternoon. At around 4 p.m. Flatulence and gas trapped in the right quadrant, right hypochondriac quadrant. So this is the case presenting. I think most of you would say, well, that's presenting quite a clear picture. The symptoms here we see that I used this condition. So we have necrosis here representing the bone loss, infection, pain, jaw extending to ear, and then swelling of lower jaws, inflammation, periosteum, lower jaw, pain in the right hypochondria, eating to satiety. We have exactly this symptom in Compass that she described. Cough, cold air, right shoulder pain, sleep on abdomen, desire for sweet, strong, warm drinks, strong, right-sided. So I think we'll see here a very clear picture of lycopodium. However, we can have a look here at lycopodium covers 9 out of 11 symptoms. So a very nice totality, actually, to a few symptoms. Is it 11 or 12? Oh, there's 2 together there. So yes, not actually covering the specific jaw symptoms, apart from this one, but the generals covering. And then we have phosphorus. We know this is a remedy that affects the jaw very much. And with only 6 symptoms. And then we have chelidonium, 5, etc. Here we have some, as I've shown you before, metadata. This is a useful bit of information in VithoulkasCompass that gives some little snippets of genius from various teachers, mainly George Vithoulkas. Here we see, so we click on metadata and we see both lycopodium and chelidonium are right-sided remedies. Characteristic difference to chelidonium is the radiation of the pain to the inferior angle of the scapula. So pain, right hypochondria, going through to the right shoulder blade. Lycopodium tends to lie on the right side, whereas chelidonium does not find relief in this position. So you remember she said, I can't lie on my right side. So this gives us perhaps some little doubts, and we think maybe maybe it's not. We need to make a differentiation. If I close this, so we can do a differentiation here between Lycopodium, phosphorus, also Medarinum was there. You can see, where was it in the repertorization? Medarinum. Has a few symptoms, but we also had the early heart disease of the males in the family. So this puts us thinking of Medarinum as a possible background remedy. So for differential, we see here really that Lycopodium covers most of the case. It's more of a totality than any of the others, and the main keynotes and general symptoms are there. Patients not really, if you notice here, there are no mental emotional symptoms. They're not affected on this level. There's no disturbance on this level, so we don't include any symptoms. It's very important to understand that mental symptoms have to be present to be used. I think sometimes people are using mental rubrics, mind rubrics, to describe people's personality, and it's not pathology. And this will completely skew a case in the wrong direction. So only use mind rubrics if they are present and if they are pathological, i.e. the patient is suffering or making other people suffer. Otherwise, leave them out. So she has none. And we see here, so we don't have a lot to try to distinguish on that level between these remedies, but in general, Lycopodium fits the totality. Phosphorus has the typical pathology, actually, more than other remedies. The necrosis, the swelling, inflammation. It's a remedy to think of, but she doesn't have the cold drinks. Actually, if you see here, warm drinks, wants hot drinks. So this discounts phosphorus. Phosphorus doesn't like hot drinks. Chelidonium. This covers more of the digestive symptoms and some generals, but again, not the specific local symptoms. We said Medarinum, we have a few things: history of childhood asthma, early heart attacks in the family, sleeping on the abdomen, things like this. So this gives us, we can also, to show you, I've shown before, but for newcomers, at this point, you can use this very interesting differential analysis. And this will bring up some symptoms specific to the case and the remedies coming up at the top here. So this is if you need to ask more questions and you haven't thought about the questions. So what's a good question for Lycopodium? Actually, the 4 o'clock was a symptom that she mentioned that I didn't put in. So you can then add it in at this point. And it will either enhance or reduce the likelihood of the remedy coming up. So this is obviously for phosphorus, cold drinks, but she doesn't have this. This is an interesting symptom of Lycopodium, isn't it? But also you see Chelidonium has it. So it would be a question you could ask your patient when they're with you, when you're using this interactively, to say, aha, do you ever find that one of your feet or hands is colder than the other? And they say, yes, I do. It's always, the right's always colder than the left. And this will confirm lycopodium. But okay, we have to be careful. Chelidonium also has it. So this is a very useful tool. Some foods, and you could ask about appearing in public, lycopodium symptoms. These things. You can even go down here and look at some main keynotes of the Roman. You say, what are the keynotes of Chelidonium? Because you can't remember them. And this gives you a whole load of questions you can ask. You're thinking, I think it's Chelidonium. And you can ask, say, do you feel better for eating at lunchtime? And they might say, yes, I do. Only remedies, and many symptoms here. You might be able to confirm Chelidonium, and so on. Case-specific differential. And this is a specific differential of symptoms between the top remedies. So this helps refine the choice again. If you're still not sure, you can ask some very specific things. Is this pain in the hypochondria worse on breathing in? And they say, yes, much worse if I take a deep breath. You've got your lycopodium symptoms. So these symptoms are very useful from this intelligent system. You see, there's probably not many of us know that symptom, pain, hypochondria on inspiration. I certainly didn't. So you see, it can help us to find symptoms we don't know are there within this repertory. So it's very interactive. So in this case, what was given was lycopodium 30C. 1 dose daily. Remember, she's on antibiotics daily. So the method here is to reduce the antibiotics slowly and repeat the remedy every day whilst keeping in touch with the patient. Now, the follow-up was on the 18th of October, so it's a month later. And what happened? She experienced an aggravation of the right hypochondriacal pain, and then an improvement in it, and then worse again. Jaw pain has been less, antibiotics reducing, still the night sweats, less sweets wanted, flatulence is less, but still better for passing the wind. So, we'll have a look at the follow-up. Let's see. So basically, the repertorization was the same. She had some aggravation, and then better, then worse again. There's some reduction in the jaw pain. The flatulence is a bit less. So the prescription was to continue lycopodium 30C once a day, continue to reduce the antibiotics. And the follow-up was a month later. What happened? She stopped the antibiotics altogether in this time, developed an abscess in the gum on the left side. This is an old symptom that came back. The right hypochondrial pain became worse after drinking some wine. And now, new symptom extends to the back at the right shoulder blade. So the symptom has now moved, not just in the front, it's gone through to the back. Nausea in the mornings, better for eating. So this new symptom or development points to a closer remedy which can be complementary. So we have here the analysis again. We've still got the jaw pain, some nausea in the morning. Now we have this new symptom here. Pain right hypochondria extending to the back. And we see 8 or 9 remedies here. The rest of the symptoms are similar. Now we see that chelidonium has moved up and magnesium muriaticum. Again, we can do differential analysis to try and decide. We see lycopodium also has that symptom. Chelidonium is known for that symptom, so adds some more weight for that remedy. Magnesium also, but not many other symptoms. So at this point, I decided to change the prescription to chelidonium 200 based on that particular symptom. This, as we saw in the metadata, it's very specific to chelidonium, that the pain will, and it's a gallbladder symptom, will move from the gallbladder area, right hypochondria, through to the right inferior angle of the right scapula. It's very specific for chelidonium if you see this symptom, and considering that the remedy comes up very closely second place here. Both remedies, like sweets, we know the desire in lycopodium is very big. After the lycopodium, it had desire reduced. So, but chelidonium also has it. Also wakes up unrefreshed. You see here, unrefreshing sleep. It's not listed, but it should be unrefreshing sleep. Aggravation at 4 p.m. This had gone after the lycopodium. Chelidonium tends to have problems at 4 a.m. or sometimes 3 p.m. But 4 to 8 p.m. is lycopodium aggravation time, but this had gone after the lycopodium. So the decision was to give chelidonium 200C 1 dose. She's off the antibiotics now, so 1 dose, it's clear, should be sufficient. So the next follow-up, fourth follow-up on the 10th of January, 2014. What happened? She had an aggravation of all symptoms after the remedy. Jaw pain was worse for 1 day and then went. Tract win also worse, then better over a week. The dentist checkup revealed almost no osteomyelitis signs anymore. Right hypochondria pain 90% better, no indigestion in the last few weeks, energy levels much better, mood much better, nausea in the morning gone, no jaw pain at all. So we see a much clearer reaction with the chelidonium than the lycopodium. There were some effects with lycopodium. And what it did, it's that thing I mentioned last time where you give the first remedy, perhaps the case isn't as clear, or it needs a first remedy, and then a new symptom develops, which points to an even closer remedy, chelidonium, which happens to be very similar to lycopodium. They're very difficult to tell apart sometimes. So at this point, prescriptions to wait. You don't do anything at this point, you just wait. It's going very well. Now, the next follow-up wasn't until the 1st of July. So some months, 5 months. And she reported that the indigestion was a bit worse after the Christmas festivities, overeating, and some pain from the right hypochondria to the back again, so slight relapse in those symptoms. Interestingly, she'd had another CT scan which revealed that the pancreatic cyst, the benign neoplasm, had gone, no longer there. Hospital x-rays also confirmed, dental x-rays, that the osteomyelitis had also gone. There were no signs of it. Had a lot of stress with family matters, looking after them all, worries about them constantly. This confirms our knowledge about Materia Medica, and I'll talk about that in a minute. So the prescription there, so we're looking at almost July analysis. Here we have the repertorization. It's reduced to the indigestion, this pain extending to the back, the shoulder, sweets, warm drinks. And we see chelidonium top now. And we again have metadata, which is the same. Tells us all sorts of interesting things about lycopodium and chelidonium, comparing with sepia, comparing with Nux vomica. This is information from Ernest Farrington, if you know him, great source of clinical Materia Medica, brilliant professor of Materia Medica in America. It gives very specific differentials between remedies and so on. Very useful stuff, sometimes from more Farrington. Yeah, sometimes it's from Professor VithoulkasCompass. So we see chelidonium here covering most of the symptoms. So prescription was to repeat the chelidonium 200. She'd had a bit of a relapse of the gallbladder pain. So that was given. And 2 weeks later, she developed an otitis, ear infection with high fever. Had some drops from the doctor. This was an old symptom of hers returning from years ago. Drops didn't do anything, thankfully. Ear pain, better for warmth and covering and stitching pains. So here we have an opportunity to treat an acute. Often with an acute, if it's a simple thing with fever, you just let it go and the case will progress very nicely. But with an ear infection, you can't. So it was very painful. We don't want the patient taking antibiotics again, if possible. So this was a simple acute, really. Inflammation here, you see media. The pain was worse at night, better from covering the ear and stitching pains. So we probably all know that this comes out as Hepar sulf. Covering all symptoms very nicely, minimum in the acute. So, acute prescription, Hepar sulf 30C. Pain and inflammation resolved in 2 days. And then the final report in the autumn of 2014, so we're talking 1 year later. She said, feeling totally different in herself, much better energy, no osteomyelitis reported or pain. Patient remained very well. The pancreatic cyst also was gone. There was no information about the liver cyst. So this levels of health on this case, for those of you who know this important model, actually this lady's level of health was quite good, despite the chronic nature of the complaint. She always had fever with her acute flare-ups of the condition, not so high, but always fever, suggesting that she was already in a higher group. The remedies were clearly expressed and only needed 2 remedies for cure. So all this criteria tells us that the patient was in an upper group. In the lower groups, takes many more remedies to obtain a cure, and they're not clear at all. Also, the aggravations were short-lasting, a day, 2 days. All this information tells us that probably she was in level 3 or 4, group 1 probably. And so these cases, as we know, with the correct prescribing, they can be cured relatively easily, and it can seem quite miraculous sometimes, even quite strong pathology in these groups. So these are unfortunately less and less people now belong to these groups. So it's getting harder for us, sadly. I wanted to have a look at let's have a look at so here you can see, I can show, if we want to have a look at the materia medica, we can talk a bit about chelidonium here. We can click on this book here, and it will bring up the materia medica, the GV notes. This is from Professor VithoulkasCompass, unique feature of VithoulkasCompass. And we see immediately gallbladder, liver affections. Now this is interesting. We had some information in the case, if you remember. She presented as a very organized, and she said, I'm rather controlling person. So she gave us a clue in the beginning. They're rather domineering, want others to listen to their advice, and likes to run others' lives, especially in the family. But it's done in a way that's different to lycopodium. Lycopodium has a very dictatorial way of treating the family, treating them quite badly. Kind to strangers, badly to their family. Chelidonium, it's done in a very beneficial way. They want to be helping their family, but they want to be in charge. So it's a different flavor to the type of dictatorialness. We don't, And also there's a big difference between lycopodium being a more, so we say, cowardly remedy, and chelidonium being the opposite. They're very brave and powerful people, get things done, don't mind facing up to things. So lycopodium doesn't like to face up to responsibilities. So these aspects we can use to try to understand our patient and say, well, that fits better. Actually, the chelidonium was closer to her case in that sense. Gallbladder, liver infections. You see, and here we go, pain in the right hypochondria, extending to the back, inferior angle of the right scapula, worse breathing. Right-sided complaints, like lycopodium. So you see, they're very complementary remedies. You can often use them either way around. First lycopodium, followed by chelidonium, or the opposite. Often we'll see this. One is needed after another. And we see the warm drinks like lycopodium. But there's also a thing I've seen many times with chelidonium, is that they usually they desire cheese very much. It says aversion as well, but I find it's more craving cheese. And they can eat large amounts of cheese, which is an interesting symptom considering they have liver and gallbladder problems. But it appears to be something they can eat without problem. And then we see here, we've got, of course, Burraca, much more information. Clark, huge amount of information in Clark's Materia Medica, if those of you who know it, very useful. And Kent, of course, which gives us always good insights into remedies. Right-sidedness. And chelidonium is also a big pneumonia, bronchitis, lung remedy. Very similar to bryonia. Those of you who don't know. Both are violently worse from motion. So you have to often distinguish in pneumonia between bryonia and chelidonium. So we come back to the case. I've shown you before the features of search where you can say, right, I want to know a bit more about chelidonium. So you select it, you just type it in here. And then you say, I don't know the mental picture of chelidonium. And then you can say, I only want to see the 3rd and 4th degree, the high degree symptoms. So you deselect those and you search. Not many. So we don't have a highly developed mental picture of chelidonium, but you see what they have 4 symptoms in 3rd degree. Guilty. They feel guilty. Delirium, indolence, aversion to work, aversion to mental work, so a kind of laziness. Then we can add in, okay, let's have a look at the 2nd degree remedies. And we have delusions about criminals, again, this relating to this guilt feeling. Some religious symptoms, etc. Dictatorial, you see, it's not interesting. You see lycopodium in 3rd degree, Medarina, Chelidonium's just in second. It's a different type of dictatorial, as I say, out of trying to control their family, but in a beneficial way. So in this way, you can search and look at the keynotes. For instance, lycopodium. And then you can say mind. Let's say maximum size of the rubric 1. Let's take out that. So this is where you're looking for lycopodium symptoms in the mind chapter, where it's the unique remedy. These can give you very interesting insights into remedies. See, irritable day, cross, irritable all day, good all night. Only remedy. Useful for some children. Kicks child is cross, kicks and scolds on waking. Weeping, 4 to 8. Weeping when thanked. See, these are very, very specific, only remedy, 3rd degree, gives us an insight. Fear of being alone in the house. We know this symptom of lycopodium. This is, here we are, hard for inferiors, kind superiors. And all these things we know. So it's just to show you how you can look at remedies. Some other differentials with lycopodium and chelidonium. Chelidonium tend to be better for eating and lycopodium worse. So with their digestive symptoms, gallbladder symptoms, lycopodium tends to aggravate from eating and overeating, and chelidonium, they feel better. For instance. The 4 p.m. is more lycopodium, 4 a.m. chelidonium. Both have right shoulder pain. Both can have right-sided headaches. Both like warm drinks. Chelidonium likes the cheese. Lycopodium more the sweets. So there's some good points to distinguish the remedies. Okay. So I hope that's been of interest. I see we have a lot of questions.
Thank you very much, Andrew, for this very interesting case that shows us the possibilities of homeopathy, not only in common colds, but only in severe conditions like this. And we have a few questions. The first question is it a one-sided case, one-sided disease as Hahnemann describes it in Organon?
Well, in a sense, one-sided as it doesn't have any mental emotional symptoms, but they're not there. Mm-hmm. So I wouldn't say exactly that's what he meant by that. He meant there's a lack of symptoms.
Yes.
Generally. So here it was quite a clear prescription. So I wouldn't say one-sided really.
Mm-hmm. Okay. And another question is, why did you give only one degree to the main complaint in your repertorization?
Yes.
I think it means in the first repertorization of lycopodium.
This one?
Yes.
Mm-hmm. I've got this in 3rd degree, in this one swelling to inflammation here. Yes, yeah, good question. It could be put in a second. It wouldn't make any difference to the repertorization. I tend to put, for some reason, I put this as 3rd. It's probably too high, really. That ought to be, I would say that they should all probably go down to 1. but I don't think it would make any difference to the. That's the same. Yeah. So the physical pathology, I tend to put in a slightly lower degree. Yeah.
Great. Okay. Another question is, how did you evaluate the grief from 2009?
Yes. I didn't use it because it didn't seem to me that she was suffering from the grief when I saw her. It was part of her history. She'd grieved. It was possible causation, but I didn't use it because we can't be, unless you're absolutely sure that it's the causation, then you shouldn't use it. If you used ailments from grief and it's not the causation, you're going to change your repertorization a lot. We can have a look and see probably lycopodiums in that rubric anyway. Yeah, it's there.
Yes, it's there. Yes.
So, but yes, it would, if you put that in a high degree, it would suddenly shift your case to something distracting. And actually she wasn't suffering from the grief then.
Correct. Yes. Okay. The other question, I think you have already answered to it. It's about the level of health. You said that it is high level, level 3, perhaps because of the response that she had.
Yeah.
Okay. Another question, could it be chelidonium from the first place?
Yeah, I was expecting this question. Well, it could. In this case, it could. We'll never know. As chelidonium also has that symptom, as lycopodium also has it, of going through to the back. And considering how she was as a person, I think it's possible that you could have given it from the beginning. It seemed to me lycopodium was the first remedy to start with, and then the symptom developed into chelidonium picture. But they're very complementary, so it's
Okay, the other questions, these questions are about the acute. Did you give only one dose of heparin sulfur? Only one 30C?
Yeah.
Only one
dose.
dose of 30C, okay.
Yeah.
Another question is, do you have a more recent follow-up?
Not from her, unfortunately, no. No, we lose track of patients. It's 10 years. Yeah, I don't know now, unfortunately.
Okay.
A year. We had a year follow-up, so yeah.
Okay, very good. We have a lot of thank yous. Thank you so much for this case analysis. It was very helpful. Okay, I think that's it. Thank you very much about this very interesting case. We enjoyed it very much. Let me see if we have anything else. No, okay, I think that's it. Thank you very much, Andrew, for this. We thank the Faculty of Homeopathy for its support, and then Dr. Gary Smith. And I give the speech to Gary now to close it.
Thank you very much, Lefteris.
Thank you very much, Lefteris, and thank you, Andrew, for another excellent case. Thank you very much. Another case that's needs to be published somewhere if it hasn't already been. A really excellent case. Thank you. So yes, thank you, everyone. I just will take a moment or two to close the webinar. If you're on the call and you're interested in using VithoulkasCompass and you don't already, then please contact Eileen Abati, and the email address is shown there, and you can have a free trial period and a 20% discount. And if you're a member of the Faculty of Homeopathy, you can benefit from a 25% discount from the of the software. Next slide, please. Final slide. And if you are a statutorily regulated healthcare professional in the country where you practice, you can be a member of the Faculty of Homeopathy. Although we're headquartered here in the UK, we have members in 32 different countries. So we're an international membership organization. And if you have a statutorily registrable qualification and you'd like to be linked with the faculty, please drop us a line, info@facultyofhomeopathy.org. And in doing so, you can avail of a host of other CPD resources, other webinars, free subscription to the Homeopathy Journal, International Research Journal Homeopathy, which is the only Medline listed journal in the world dedicated to homeopathy. That's published by ourselves, the Faculty of Homeopathy, and our membership magazine, and lots of other benefits as well. So please contact us if you'd like to know more. If you don't have a statutorily registrable qualification, contact us anyway, because there may be a way that we can have a link and an affiliation. But membership is for those who have a statutory qualification. So thank you once again. The only other thing that I'd like to say at this point is, before my voice goes, is save the date for the next webinar. The next installment in this series is Sunday, the 25th of June, which I think is 9 weeks today. So please mark that in your diaries. The details will be communicated in due course. And I think that's probably everything. If you're interested in knowing more about the faculty, please drop us a line. And my voice, I think, is gone. So thank you one and all for attending. We'll see you next time.
Thank you very much, Gary. Thank you very much, Andrew.
Thank you.
We will upload this webinar in YouTube, in our YouTube channel, and you can watch it. You can subscribe there to see the other webinars as well. Thank you very much again for participating in this, and see you in our next webinar. Bye-bye.
Thank you.